This testimonial is about how the ancient unified system can be used for solving any problem. In my case, I'm here giving the way how my mom's psychiatric problem was also cured in a very short time. The purpose of this uh, talk is to prove the fact that for any problem we have to find what cause the problem, what is the root cause, and treating it only is the efficient and the right way. Then also I understand that now the most of the problem is that people are relying too much on medicines without understanding the fact that medicines are only one part of the five things that brings health. Now, current Ayurvedic system is also not complete, which I will discuss how I took her to all these treatment methods and was inefficient even in Ayurveda because the medicines are made up of adulterated ghee, oil, and herbs. And how will that work? So I will discuss all the events that took place from 28th March 2018 till May 5th, almost 5 to 6 weeks. How a huge problem that I myself doubted that I can see a result or a relief within such a short period. So when I reached 28th March 2018 to Kerala, hearing that my mom is not doing good, when I saw her, I cried because she had become almost like a 95% mental hysteric person who was just saying some same things again and again of the traumatic experience she had a week back. So this is not to prove that we should not go for any medical system or anything. I just wanted to convey how a holistic approach alone could solve a problem, and I hope this will also help you. The psychiatric problem of my mom started slowly manifesting for the past 2 years when I found that she had been given too much of allopathic medications. In 2013, she was put under strong BP reducing drug, which decreased sodium levels in her brain, and she had a fainting episode. And then again in 2013, I interfered and gave the holistic unified treatment, and she recovered tremendously good. Earlier, I had learned a lot of herbal remedies and the alternative therapies from her only. She had managed good health, but when I had from past 4 5 years, when I had spent too much time helping others, naturally I couldn't stay much home when I visit every year, every 5 months in India. Earlier, I used to stay with her for 10 15 days. But then, as time went by, I had started staying only 2 3 days. But she was okay with that. She was saying, "Yeah, you help a lot of people, so you could go." But that was not the issue. But I started understanding that my dad, who like everybody, I cannot blame him. Like most of the people think that just by taking tablets, all the problems will go. Instead of addressing the root cause of her blood pressure, he forcefully made her to avoid the herbal ways and or alternative ways and just follow the medications given by doctors, which is not wrong because for some symptoms to go away, immediate way the drugs can be given, but in not it should not be taken for a long period because of very unpleasant side effects. So this was the thing I conveyed to them, but they were my dad and the relatives were more insisting that she should take the medicines. Then apart from that, there was also other issues which are not going into detail, that she started talking less to people around her, relatives and friends, and then she went into that depressive state, and then there was dementia also. She started talking things again and then again, and I kept telling my dad and my relatives that she needs immediate assistance, but they were saying that they should be taking her to a psychiatric doctor. I said that doesn't help. That won't help because we know what is the root causes. If you don't address that issue, it is not going to help. Just taking psychiatric medications for depression, it is just going to numb more of her mental abilities. But this, nobody listened until another precipitating incident happened in the second week of March 2018. So she also had blood glucose variations, but she was under very much control for past 20, 30, 20 years. But then my, again, external influence of people saying that you have to take medications and all that. So she was forced again sugar medications, and I understand that was dropping too much of her sugar levels, and that was one reason why dementia was seen in her, but nobody listened to me with the aspects that I tell. So then what happened was the second week of March, she had a fainting episode, and naturally I understand it was because of too much sugar went down in her blood. And immediately my dad and my relatives, they were panic, they called the ambulance, put her in the ambulance and took her to the hospital, where they put her in an intensive care unit, ICU unit. So when she opened her eyes, all she remembered was she was at home, and suddenly when she woke up, then in the intensive care unit, nobody was there, nobody was around. She was in a confined room, and she got fear, panic, natural anybody, because she didn't know what was happening. So then later, few minutes later, a couple of nurses came, and they were strangers for her. They came and grabbed her chain and rings and bangles and earrings. But she didn't know that they were nurses, because she has no clue, and she felt she was robbed, and that added. And we don't know what else happened, because I can understand from the pattern of her behavior what all would have happened there. So then after that, she was started shouting and screaming, and they after a couple of days, when she was brought back to the regular room, she continued having hysterical things. And my dad and all the relatives said, oh, that she's normal for past 2 years, she's having memory problems, and and that's why she's blabbering. But then when she was brought home, then it continued more intense. She started scolding everybody using very abusive languages, and on the top of that, they were doing all intellectual things, which is in the in more, they were trying to treat like her as a mad lunatic patient, which she was not. Nobody listened to her, and she became more hysterical and behaved like she wanted to run away from the room. And even she had no energy. Two people have to lift, and she started passing I mean, stools and urine in her bed, and it became worse. So this was when my sister called and said, brother, if you don't come quickly, she would be completely uh, be turned into a psychiatric patient already, because dad and relatives have taken her to a neurologist who did a brain scan and said the brain has completely shrunk. So that is why she's having Alzheimer's, and she also also had schizophrenia, and then she has bipolar disorder. So for all that, these were the medicines they have been giving, and it actually worsened her. But everybody thought nothing to do with the drug. It is her own bad. I mean, it is a disease that was becoming worsened. So there is this modafinilin used for, I mean, putting her to sleep, because she was continuously talking without any break. And I would play a small audio also, to just to see and what stage she was. And then she was also given cholesterol lowering drug, and I didn't know that because they were not telling me. And I think I don't know how long she has been given. Naturally, it will create the lipids to get lower, and brain is full of lipid things only. So these will have definitely an effect of on that. And on top of that, for bipolar disorder, she was given an antipsychotic drug, quercetin, and then Donep and Memetin for Alzheimer's disease also. So all this she was given, and my sister said, only you could understand that instead of the symptoms getting lower, she's becoming worse, and nobody is understanding that, and everybody are blaming you that you are the one. If 2 years back, if you had taken measures to take her to a psychiatrist and give all the medicine, she would have been better. So you please come. So that's where within immediately I booked my ticket and reached 28th March night at home.